Okay, moving on to vital signs. Just like our assessment tab, we can click the lower left-hand corner to add. And again, like our assessment tab, what it will do is when we add a new one, we'll put it at the Add Patient side, or it will link it up with when the last intervention or assessment you put in. So since we have nothing else input right now in this particular patient care report, it puts us at patient side. Again, you can click anywhere you like in the report as long as it falls within the proper time frame. So we'll leave it at this time for now. Prior to arrival is defaulted to no. Please change it if occurred otherwise. Who performed. Now I'm moving on to blood pressure. We'll just click through these at this point. If I hit tab from here, it will take me to pulse, so click over to diastolic to input that. You'll notice a lot of the within normal limits are found at the top of the menu to make it easier. Okay, refill glucose if you have it at this point. Our GCS will calculate at the bottom of the screen here as I click across. Our GCS qualifier gives us a reason to document why a Glasgow coma would be less than 15. For instance, if we gave Versed or etomidate to a patient to sedate them, then we can document here, and that's why their GCS is the way it is. However, this is not a required screen. Lung sounds. Stroke scale, if you did it. Thrombolytic screen is actually required per EMSS, so we default that to not applicable. Alert. Normal pupils. I'll put the pain at a 5. Skin, normal. Body temperature is the last thing here. If I want to delete this particular set of vitals, I simply click the X here, and it'll delete me out and take me back to this main screen. If I want to copy the current set of vitals that I have, if I did 3 or 4 sets of vitals but nothing really changes at blood pressure and pulse rates, I could simply hit this button here in the middle and it will copy it as many times as I click it. If I want to go back to one of those, I can either click it up top here or click vital signs here, and it'll give me the menu of all the different options. This button here will simply give you a brand new set of vitals from which to report from. Adding scores is our next little tab here. What this allows us to do is document trauma scores as well as APGAR scores. They're pretty much straightforward to go through, just your menus just like anything else. Medical devices. This allows me to, if I have a monitor or something where I can actually pull data over, like an X series from Zoll corresponds with this program and you can move data over, it allows me to do it here. So I have nothing on my computer to demonstrate this, so it's something that is going to be department specific. That's really all there is for vital signs. Next we'll talk about interventions.